The University of Iowa has successfully vaccinated most of its frontline healthcare workers at University of Iowa hospitals and clinics, and has begun vaccinating individuals who provide clinical patient care in the healthcare colleges and departments, and this includes faculty, staff, and students. Similar to frontline hospital employees, these are individuals by the nature of their jobs put them at the greatest risk for contracting COVID-19. The University of Iowa is following the Iowa Department of Public Health's guidelines for priority populations in Phase 1A, which is limited to healthcare personnel and those working and living in residential care or long-term care facilities. Faculty, staff, and students who have been identified as clinical care providers will be notified of their eligibility in the coming days, but it will likely take several weeks or more to vaccinate the entire group. There is a limited supply of vaccine available, so we appreciate your patience during this rollout. The Iowa Department of Public Health recently released the recommendations for who will receive the COVID-19 vaccine in Phase 1B starting in February. Some of the populations include people who are 65 years of age and older, first responders like firefighters, police officers, and social workers, pre-K through 12th grade education and child care workers, and staff and individuals living in congregate settings. However, that does not include college residence halls. The university's vaccination distribution work group, along with the Johnson County, is reviewing the Phase 1B recommendations to determine eligible populations on campus, and we will share that soon. Please understand there is limited vaccine, so not everyone will be able to be vaccinated right away in February. Johnson County Public Health will inform the public when and where they can receive their vaccine. There is no sign-up list for individuals. Instructions on how to access the vaccine will be shared as soon as plans are finalized with healthcare and pharmacy partners. Please do not call pharmacies or healthcare providers at this time. If you have been identified as providing clinical care, you will be notified by email when it's time to schedule your vaccination. You do not need to contact anyone or fill out any paperwork in advance of receiving the email. It will provide instructions on next steps. It is going to take several weeks to vaccinate everyone who is eligible in Phase 1A, so we respectfully ask for your patience. We are moving as quickly as we can through the supply, but we cannot control when or how many doses we receive. We are actively monitoring communications from the Centers for Disease Control and Prevention and the Iowa Department of Public Health. As soon as we have more information, we will share it with campus. Keep checking your email for the COVID-19 campus updates or log on to coronavirus.uiowa.edu. Remember, right now only healthcare personnel and those working and living in residential care or long-term care facilities are approved by the state to receive the vaccine. Like other drugs, vaccines released in the U.S. must go through multiple phases of rigorous analysis and review as they're developed. The two vaccines approved by the U.S. Food and Drug Administration, the FDA, for emergency use were carefully evaluated in clinical trials, including one at the University of Iowa hospitals and clinics. They underwent the same authorization process as any vaccine. There are commonly reported side effects, including sore arm or redness at the injection site. Some have reported fever, fatigue, headache, and body aches. These side effects are considered normal and mean that your body is responding to the vaccine and the vaccine is doing its job. Most of the people described the symptoms as mild or moderate and that they did not disrupt daily activities. We know there's a lot of excitement about the vaccine and people are anxious to know how the university plans to distribute the limited doses it has received. As the state shares more information, we will share it with campus. In the meantime, the best way to stay healthy is to continue the practice of wearing a mask, watching your distance, and washing your hands. Thank you.